If you hurt your back squatting or deadlifting, the best way to fix it is with more squatting and deadlifting, because it's not the exercise that's the problem, it's your inability to execute correct technique or that you lifted far too heavy a weight. In today's podcast, we're discussing why leading sports physios have their patients perfect their technique with the barbell back squat and deadlift in order to overcome lower back pain. What's up, Yanni? So today's episode, I had a message from one of our members of the UMS Tribe membership. And through the coaching I've been giving him, he's told me, I asked him how he's going with the program. And he said, really, really good. He's just a bit afraid of the squats and the deadlifts because he's had some really bad back pain in the past. And he talked to me about the last time that he had a flare up. It hurt him for 6 months. He was basically, in his own words, like out of action for 6 months. And it got me thinking, like, how often we get these comments, right? Like, we get these people so often that are so afraid of it's always squatting and deadlifting with lower back pain. And I thought that we could add some value because of my personal experience. Well, both our experiences, but yeah, my experience with my lower back pain and where I've come from being, unable to get through a full day of work and needing to take painkillers all the time to basically having virtually no symptoms now, So that's what I thought we'd talk about today.
I think that we can use like personal anecdotal case studies, but also we've got so many good client case studies. Adrian Sneary is a classic example of someone who came into the gym, looked at what we were doing, the types of training, and just went, man, this isn't for me. This is how I hurt myself, Yep. And Lockie's another one. I mean, I could rattle off probably a handful, half a dozen people who all had that same experience. And I was exactly the same. My experience as a teenager growing up, getting physical therapy, was that I was told to not ever squat or deadlift. And as though, it's almost like people view it as though there's only one weight you can lift and one rep range you can do.
Yeah, that's right.
Like if you get under a barbell to do a barbell back squat, it's 120 kilos or nothing.
Yeah.
And you've got to do it for 5x5 or 7 reps or 10. It's honestly just totally bizarre, as though there's no way of regressing that movement and training the brain and reinforcing that there's no risk here, because interestingly, now that we know what we know about pain science, that mindset could potentially be enabling the injury, the continuation of the injury.
Well, it is enabling it because it's preventing people from doing what needs to be done to get better.
But considering that pain is a symptom of the brain, 110%, there's no argument to go against this. Pain is a symptom of the brain, and it's generally based on a perceived threat. If you've just damaged tissue, then it's the threat of making that damage worse, or the reality of how bad that damage already is how much pain you experience. And then in many cases, the concept of phantom limb pain and residual pain or chronic pain, it's due to the brain's perceived threat of what's going on in the body. So if you're walking around telling people that you're already compromised and therefore cannot do X, Y, and Z, then you're really, not exaggerating, amplifying is the word I'm looking for, the brain's perceived threat of that exercise. And so, where does it stop? Like, does it stop just in the gym, or does it also play a role when you squat down to pick your child up off the floor, or when you bend over, like doing a deadlift, to pick up the luggage when it comes around the turnstile after you get off the plane somewhere on vacation? Like, at what point does the brain stop it being a perceived threat and stop issuing out muscle, pain in the form of really bad lower back muscle spasms and things like that?
And the idea, from the title of this podcast and what we're talking about, this idea that squatting and deadlifting is some of the best things that you can do for lower back pain. it's not just our opinion. It's not something that Yanni and I have said, oh, this is what we think and we're going to push this on people. This comes from almost 2 decades for me now of exploring how I can manage some pretty bad back conditions, which I'll go through with you in a minute, and working with really good chiropractors and also some really good physiotherapists and understanding what their approach is for long-term lasting pain relief. And when it comes to the physiotherapists that we've worked with, closest, Phil White and Nilesh Murthy, both of them had people squatting and deadlifting in their physio sessions at the gym. And it was because Yanni and I went up and asked them, why are you getting them to squat and deadlift when they've come to see you for lower back pain? Because we had members, where this really came from, I remember actually, is that we had some of our gym members who had lower back pain, and they said to me when they were doing their squat or their deadlift, they said, oh man, this exercise is hurting me, what should I do? And we had these physios working in the gym, and I said, you should go and see Phil or Nilesh. They're right here in the gym, they're really good, and I've got an open line of communication with them, so whatever they tell you to do, they'll tell me, and I'll make sure that I modify your program like that. And then I watched them do their physio sessions, and they were doing squats and deadlifts in the physio sessions. And so then I went up and asked them, I said, why are you doing squats and deadlifts? That's what they came to me for. And sorry, that's what made them come to me when they said, this is what's hurting me. And they said, yeah, that's the exact thing that they need to do, but they need to do it better. They're not doing it good enough. They don't have the technique dialed in. And so when I watched them doing it, often they were doing, like for example, like a hang deadlift. If you don't know what that is, it means where you start with the bar hanging just below your knees, not on the ground, or a box squat, for example, where you don't squat all the way down. But whatever version it was, they were still doing a squat or a deadlift with a barbell, and they were doing it with a reduced weight, and they were focusing 100% on correct technique. So learning how to move the bar vertically, not letting the bar travel forwards and backwards, because any lateral movement with the bar in a squat or a deadlift can put a lot more pressure on the lower back. And that obviously led to many, many, many conversations with them from Yanni and me about how we can incorporate that in the way that we do our UMS programming. And that's where this concept comes from. It comes from, working with some people that really know what they're talking about.
Well, just it goes back to what I was saying before. There's not one version of any exercise, and there's not one load that you can put on that exercise or that part of the body. What you're talking about there, what you're describing, is a regressed version of the exercise, and 9 times out of 10, it's a regression in range of motion. So they strengthen the range they can do safely, and then they slowly build on that. And range of movement is a variable that you can manage to manage your load. It's a loading variable. You don't have to do the extreme range immediately, nor should you. If you're not strong there, if you're not stable there, then the body's going to, perceive it as a threat. And when it perceives threat, you know what we get? We get pain symptoms. We get muscle spasms. We get those sorts of things. The brain tries to slow us down. And, the pain symptom or sensation that you're experiencing that you're very frustrated with, don't hate on it, because it's likely that it's saving you from something much worse. Unfortunately, we just don't tend to start exercise very well. And I used to love Nilesh's little, quote on this sort of thing. He said, it's never the exercise that hurts you, it's how you got there. What did you do in the lead up to that exercise? Did you manage yourself correctly, or did you try to do something well above or beyond your, body's capability, your strength, your stability, your tissue conditioning? Remember, all these things are occurring inside the body. It's not just the concept of enlarged muscles that we're going for here. We've got all these different types of tissue in the body that are adapting to the stress. The bones at the base level, at the foundation level, then the ligaments that are connecting those bones together, then the tendons that are connecting the muscles to the bones, and then on the very top you've got the muscles. You've also got the deeper muscle systems that are creating stability and locating the joints in position. But when we go to the gym, all we think about is the outer unit phasic muscles that are creating movement that we can flex, touch, and feel and see in the mirror. They're the last thing that we really should be thinking about when we're thinking about developing strength. There's so much happening there, and people tend to just sort of want to skip to the very end. and do something that is beyond them, and then they blame that poor exercise for for all of their problems, when really it was all the stuff they skipped on the way up that created their problems.
Yeah, and you can see a couple of examples in the background here of using range of motion as a variable. And when you've got, severe lower back pain that makes you that fearful of a squat, this is the first variable that you'd use. You'd use a reduced range of motion with really good movements like a low bar or a high bar squat, and you'd use a box so that you can know exactly how far you're going, and then that's you can increase that range in a very measurable way, just like you can with weight. With weight, you can go from a 44-pound bar or a 20-kilogram barbell, you can go up to 25 kilograms or 50 pounds, whatever that would be. By adding a tiny little bit of weight, you can measure those increments. And when you use a box, you can also measure the increments of the depth that you go with the squat. And you can do the same with a deadlift, but you do it in the opposite, where the deadlift sits on a box, where the weight plates are sitting on a box on either end, so it elevates the bar a little bit. Because for a squat, the most dangerous part of the squat is the bottom range of motion. For the deadlift, the most dangerous part of the deadlift is the part where you're picking it up off the ground. Again, the bottom of the range of motion. And yeah, it's going back to what Yanni said, this idea that there's only one way that you can squat and one way that you can deadlift, and that's with the amount of weight that you did when you were at your peak. That's the problem. That's what the real problem is, because as we age, we all have these issues in our body. We all have these, if I show you my spine here, this is a CT scan that I got this year, and everything that's wrong with my spine is here. That's L4 there, and that's L5. And L4, you can't see it here, but I've got a bilateral pars fracture, which isn't seen here. You have to see that from the front. And then and this was an acute injury. It happened when I fell down a big ravine when I was serving overseas as an infantry soldier. And that bilateral pars fracture then caused slippage of the two vertebrae here, or the disc, and that's called spondylolisthesis, where the L4 is slipped forward, or the L5 is slipped posteriorly, however you want to describe it. And if you look at L1, 2, 3, and 4, L1, 2, 3, and 4, you can look at the way that they're all in line, and they've got these beautiful healthy discs that are spacing them apart. That's what normal lumbar vertebra look like. And then you look at L4 and L5, there's virtually no disc there. So I also have what's called degenerative disc disorder, or spondylosis. And if you look at all of that stuff on a CT report, and when I've taken that to sports doctors and chiropractors, they look at it and they just go, wow, you must be in so much pain. And since I've moved to the Central Coast from Sydney, I've gone and got myself a new chiropractor, because I do still, even though I'm about to describe to you how I have very few symptoms, I do still go to a chiropractor periodically, because I do still get to a point of discomfort where I'm like, I don't want to feel this, and I know that if I see a chiropractor, I'm going to get some relief from this. And when I went and got manipulated from her, and she wanted to see me a week later or 2 weeks later, and I booked in for like 2 months later. And when I went and saw her, and she said, how long did the relief that you got from the session that you had last time last? And I said, I had to think about it. I went, about 6 or 8 weeks. And she went, what? And I said, yeah, but it's like, I'm here 2 months later. I started to feel it again a week ago. And she was telling me about how people that have the same conditions as me come to see her 2 or 3 times a week, and they're lucky to get 1 or 2 days of pain relief from a treatment. And she was going through all these reasons as to why that could be the case. But the truth is, it's because of the work that I do in the gym. It's because of the UMS training. It's because of the way that for the last 15 years, I've worked with chiropractors and physiotherapists to understand the process of what's safe and what's not safe. And then I've worked with my brother Yanni to develop this UMS, which is all about, like what Yanni said, it's dealing with inner unit strength. So muscles, the deeper muscles that you can't see, the hip stabilizes, the knee stabilizes, the core stabilizes, but then also building the strength with that inner unit up with the outer unit, and not avoiding the exercises that, like a squat and a deadlift, that people are fearful of, but rather understanding how I can use those exercises safely and how I can still build up my strength. And for me, it's funny because if I go back 10 years ago, so I'm 45 now, 10 years ago when I was 35 and I'd been out of the army for a year, by far the biggest priority of my training was to get rid of lower back pain, and it was really bad. I was seeing either, Yanni, you remember, I used to go and see the chiropractor pretty much every week, and I'd see the physio whenever I needed to, but it was all the time that I was going to get either a chiropractic treatment or a physio or a sports massage. But it got to a point where my lower back pain was no more because I'd developed the strength and flexibility that was required so that I could, do the things that I wanted to do. And then later on in my later 30s, I had some slap tears, one in each shoulder. And I spent the next 4 or 5 years, probably 4 years, really getting myself back to where I wanted to be with that. It took about 12 months to get back to like my baseline where I could do the things I wanted to do. And since then, it's been about getting stronger than I've been. And I was actually thinking about it in my workout today and yesterday when I was doing my bent arm strength, so working on handstand push-ups and pull-ups, and doing my straight arm strength, working on calisthenics movements like planches. And I'm now stronger and more capable than before I had those slap tears. I can do more reps of exercises that I could barely do before, and I can do better quality. And it's because I've followed this process of, even though I've been injured, of working on exercises that I can do, managing the load properly, developing the technique, and then slowly leveling up. And for me, my lower back pain, it's not even something that I really think about anymore or have to manage because it's just become ingrained in the way that I do my training. And it's, it's something that Yanni and I genuinely believe. I won't make the blanket statement and say anybody can get rid of their lower back pain, but I honestly believe that anybody can improve their situation. And we've had members, Yanni talked about Adrian. I can think of 2 other members, Lachlan and Nick, that all came to us with such bad lower back pain that they flat out refused to lift a barbell and do a deadlift. They just said, I won't do it. I know that it's going to trigger my back. And so I had these guys starting but with a dowel rod, like that means a stick, like a broomstick that might weigh 100 grams or something. And they were just going through the motion and the movement. And then they went to a 2-pound weight and then a 4-pound weight and then a 8-pound weight and then a 10-pound weight. And all of those guys became some of our strongest members in the gym. I remember Adrian Sneary went from completely rejecting all use of barbells to being able to do Olympic clean and jerks above his own body weight. Lachlan was deadlifting and squatting well above his own body weight, and Nick was doing the same thing. I remember I looked at his barbell one day when he was deadlifting and he was doing 150% of his body weight. He was doing 135 kilograms, which I think is about 300 pounds. And he weighed about 180 pounds or 170 pounds, which is, I think, about 80 kilos or something like that. And I asked him, I said, that's 150% your body weight, isn't it? And he said, yeah. And he laughed. And I said, it was only 9 months ago that you were too afraid to lift a barbell, weren't you? And he laughed and he went, yeah. And so this isn't just something that is unique to what Yanni and I have been able to achieve. This is something that we've been able to replicate with many, many, many people. And the take-home message is, it's not a black or white scenario. It's not I either can deadlift and squat and do all the weight I want to do, or I can't do it at all. There's this scale, there's this gradient in between it, and it's like, Yanni and I, it's always a struggle to illustrate this without a proper graph. But if you imagine there's this thing called the issue intensity continuum, and, on one end you've got your issue. So you've got, this is how bad your issue is. Like over here, you've got no injury, and over here, you've got a 10 out of 10 injury. And then over here is an inverse relationship to how hard you can train. So over here, you can train 10 out of 10 as hard as you want, and up here, you can only train a 0 out of 10. So if your injury is a 10 out of 10, you can only train, it's not a 0, you can only train at a 1 out of 10 intensity. But if your injury is a 0 out of 10, you can train at a 10 out of 10 intensity. But then there's this scale between there where you just have to work out where you sit on there. So if your issue is a 4 out of 10 pain, you can train at a 6 out of 10, and if you understand that and you learn to just use progressive overload and manage your load effectively and work on technique, you'd be amazed that you can still squat and deadlift. And before you know it, like in less than a year, for everybody that we've worked with that had CT scans like what I've got, where you look at it and they can go, look, I've got no disc, I can't do this. They go from that to being able to absolutely squat and deadlift a really respectable amount of weight in less than a year, less than 12 months. Every one of those 3 people, and including myself and including Yanni, had a recovery like that in less than 12 months.
Yeah, look, I think the take-home message here is that pain is a perceived threat, based on perceived threat, and the best way to lower the perceived threat to your brain is to increase strength, and in saying strength through range, which is sort of AKA flexibility. Those 2 things should be your number 1 priority if you're trying to manage pain or get yourself out of some form of pain. Both Rad and I have seen this firsthand for ourselves and hundreds of our clients around the world. And it's not uncommon to fear something that has hurt you. You know, if you get into a really serious car crash, you become afraid of driving in cars. That's totally cool. But you've got to understand that the best way to increase overall strength is to focus on the foundation, or what we call the fundamental movement patterns, which is to squat, bend, lunge, press horizontally and vertically, and pull horizontally and vertically. Those are the fundamental movement patterns. And you can't, just sort of make a choice that 2 of the most fundamental movement patterns, squatting and deadlifting or bending, are ruled out now because that caused an issue for you at some point, because they're very hard to avoid in everyday life. And you're really setting yourself up for a life of pain and discomfort by not developing skill in those movement patterns. And just remember, as Rad just said, there's not a one-size-fits-all approach. There's so many ways that you can regress those movement patterns and load those movement patterns, and in doing so, manage the load when you're practicing and developing the skill in those movement patterns. So just speak to the right people, hang out with the right people. For God's sake, stop trying to do what your mates are doing in the gym and do what you should be doing. And, if you don't really know what you're doing, seek help from a good coach.
And if you want to, I'm going to do a shameless plug here, if you want to have your hand held through this by people that absolutely know how to train people through this process, you can join the UMS Tribe membership. The monthly cost is about 1/3 of what you'd pay for one physio session, and you'll get you'll get coached, and you get customized programs. So you can, if you go to unitygym.com/UMS or just unitygym.com, you can do a trial of the UMS and try it out for yourself. And hey, we put out a lot of free content to really help people. This was in response to one of our members asking some questions, and we thought, look, this might help some people. If you've listened this far and you got value out of this, please share it with a friend. Chances are somebody, this is a kind of topic that can truly change someone's life. It really can. So if you've got anybody that you think of that have this kind of fear of exercise, and they're living in this world of pain, and they're desperate for relief, and they're putting money into all these treatments that just are doing nothing more than a little bit of a band-aid fix, then please share this. Do it right now. Take a moment to share the podcast or the YouTube video, wherever you're consuming this. Click that little share button, copy the link, and paste it into a message or an email, or however you do it. It would mean the world to us, and in all honesty, it might be the thing that truly changes the life of somebody that you care about. So do it right now, share the love, and give someone the gift of living in a body that they can love and enjoy. And thanks so much for tuning in. Like and subscribe. Of course, we put out content like this every single week, every day. We've got new content, so make sure you like and subscribe, and we'll see you in our next podcast.